Patient A, an 81-year-old man, came to see his doctor for a routine physical examination. The doctor noticed that his liver seemed a bit larger than normal.
Percussion is used to estimate the liver span. A normal liver span is 10 to 12 centimeters.
Okay. Could you put your other index finger there?
This is the scan of the patient's liver. It's taken from the transverse, or axial, plane. Here are the left and right, and the anterior and posterior sides. It's divided into 8 segments numbered 1 to 8. Here you can see a large dark shadow measuring 7.5 centimeters by 7 centimeters, located in segments 4, 5, and 8, deep within the center of the liver. You might also notice the areas of lighter and darker patches within the shadow. Unfortunately, this is characteristic of hepatocellular carcinoma, a common liver cancer. Soon, patient A was wheeled into theater for an operation to remove the tumor. This would not be an easy operation. There's the risk of damage to surrounding structures or puncturing blood vessels in the area, which could cause major bleeding. There's also the question of which sections and how much of the liver would be resected. Too little and not all of the cancer cells would be removed, risking the regrowth of the cancer. Too much and there would not be enough parenchyma to preserve proper function. When an airplane suffers an emergency, an engine failure, a terrorist incident, fire on board, there are plans for every situation that trained professionals follow in order to diagnose and manage the situation. However, traditional surgery relies on manual measurements, 2D imaging and the surgeon's experience, factors which are prone to error. According to a study by the University of Manchester, preventable surgical errors occur in 23% of patients, with 12% of these being severe or leading to death. Today, with the development of AI algorithms and high-quality imaging, surgeons can now plan operations in a virtual environment.
How we use it at the moment, we most likely liaise on the imaging such as CT scan, MRI, or any imaging that we have, and there's a kind of softwares that they are being used to reconstruct the anatomy of the patient, and then they will guide you into the operation, how to do the operations and what to predict and what to avoid, and the anatomy and all the kind of aspects that you would like to know prior to carry on and doing the procedure.
And it works. Studies show that this technology is more effective than traditional methods, improves outcomes, and reduces operation times. Going back to patient A, doctors used this 3D reconstruction technique to construct a model of the patient's liver. Here's the tumor in yellow, compressing the liver's blood vessels, called hepatic veins, shown in blue. In the end, doctors decided to perform what's called a mesohepatectomy, that's removing central segments 4, 5, and 8, as the remaining volume of liver was enough for normal function. In neurosurgery, surgical simulators are well established in resident training, even equipped with tissue bleeding, intricate layers, and lifelike physics. But the real game changer is the use of a virtual twin that can be customized to fit a specific patient's brain.
Patient-specific anatomy is also critical for operative planning and decision-making process. And high-fidelity rehearsal platforms could be really making a difference for our patients. And actual twin, the idea of high-level computing, high-speed computing, and patient-specific AI imaging, and how these can help us enter the new era of not only surgery, but neurosciences.
In order to preserve function of the brain, the surgery must also minimize damage to healthy tissue. With technologies such as Atlas Pathfinder, surgeons can simply upload a scan of a patient's brain, and an AI will generate the optimal surgical approach to the lesion, such as a tumor, within the brain. In this case, the tumor is located in the thalamus of the brain, shown here occupying the anterolateral region of the left thalamus. It lies just medial to the internal capsule, anterior to the pulvinar, and inferior to the lateral ventricle and corpus callosum.
Once the extent of the defect have been verified by the surgeon will then be offered a list of suggested approaches.
Just like how a pilot can use a flight simulator to practice flying a plane, surgeons can use this technology to rehearse the surgery before they even step into the operating room, improving their confidence and revolutionizing surgical education. The decision to undergo surgery in the first place involves a risk assessment, another important aspect of preoperative planning. This is a complex process that takes into account factors relating to the disease, the patient's history, the surgery, and random or unpredictable factors. The risk of surgery must then be weighed against the risk of not having surgery, and the potential consequences of both. Here, AI platforms can help to predict surgical risk by analyzing a slew of data, finding patterns and correlations that a human doctor may miss. For example, a platform called My Surgery Risk, developed by the University of Florida, uses 285 variables to predict the risk of complications after surgery and has been shown to be more accurate than doctors in initial assessment.
I'd actually like to direct the question and get your personal opinion about how do you think it will benefit you as a surgeon?
I'm yet to discover this, but I would love to think that will make my life easier by identifying what are the challenges for specific patients. We're not yet there because as I said, we are starting to learn how to use it at the moment. But I can see this is probably in the future that can take part of our daily activities.
In conclusion, good planning saves lives. Just like in aviation, where no pilot would dare take off without a detailed flight plan, surgery is heading in the same direction.